Hey everybody, welcome to episode 383 of the podcast. In this episode, I take two listener questions. The first one is somebody asking about ADHD and medications like Adderall. They ask about how you can safely taper off of them, substitutes with other medications, and I also question whether they need to be actually tapering off in the first place. So we dive all into that. In the second question, I hear from somebody who is tired of hearing their therapist talk about themselves all the time. So enjoy. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff. I'm a clinical psychologist and a self-help author from Southern California. My goal is to make mental health content for real people, just like you. And in this show, I answer your questions or dive deep into topics related to life, psychology, mental health, relationships, and more. Please be aware that sometimes I use some spicy language, and I also don't shy away from sensitive topics, but I will try to give you a content warning whenever it's relevant. So if all this sounds good to you, let's get started. All right. Hello, friends of all varieties. Thank you for joining me for this episode. I have a couple listener questions for you today. If you would like to send me in a question for the show, please send me an email to duffthepsych@gmail.com, or alternatively, go to my website, duffthepsych.com, and use the contact form there. If you use the contact form, you'll have the option to either write out a question or you can click on the widget and record a question. That can be done from your phone or from your computer. The limit is 90 seconds, which is longer than you think. So if you feel like sending in a question that I would play, audibly on the show, please do so. But yeah, a couple really good questions today. It has been an odd day from you guys. It's been really fucking weird. This is the second time I'm restarting recording this. Earlier, I went to the office. My office is about 35 minutes away from my house, and I drove there. My testing patient for the day, which is like a 3-hour appointment, didn't make it, which happens sometimes. I work with people who have dementia and, other cognitive issues. So, occasionally no-shows or getting lost or things like that, they do happen. But the second appointment I had at the office also didn't show up. So I drove out there for, no reason. And then came home and I'm like, okay, well, it's nice. I get to record the podcast during the day while the kids are still at school. I got about an hour to do that. And I was just recording, and I live close to some mountains. I live in a valley, and suddenly they're doing a search and rescue operation with a helicopter out there. So I'm like, there's a helicopter like directly over my house. And I'm like, okay, maybe I can pause for a second, just let it pass. No, it went on for like 20 minutes. And so I just had to start the recording over. So it's weird out here today, guys. But wherever you are, I hope that you're having a smoother day, and I hope that you're doing well. We're kind of cresting from January into February, so we're almost done with the first month of the new year. So hopefully wherever you are, things are starting to even out. Things are starting to get more smooth, whether you've been having stress or mood difficulties, work, family, what have you. I just hope things are leveling off and you're ready for the next month. But yeah, why don't we go ahead and get into the question before I have a full existential crisis on you? Here's the first one. It reads, "Hi, I have a close relative in their early 30s that has been taking Adderall for 3 years. He was prescribed by their GP, which means general practitioner, and they've reached a point where they feel as though they cannot taper off as they now depend on it to function. Their words, not mine. I saw something in a textbook about Provigil being a possible alternative to Adderall. Have you heard anything about this, or do you have any suggestions on how to proceed with trying to safely taper off? I understand they need to see someone and are seeing a psychiatrist as well as undergoing talk therapy and transcranial magnetic stimulation. I'm just searching for information from a trusted source. Thank you for your time." So thank you. This is a really good question, and it's a good opportunity to dive into sort of the nitty-gritty about medications for ADHD and some considerations there. I'm making an assumption that this person has ADHD, though Adderall can also be prescribed for things like narcolepsy. And just to remind you guys, ADHD is the umbrella term that we use. So that includes inattentive subtype, hyperactive subtype, and combined. So it's not broken out into two different disorders. It's ADHD. And then you just describe sort of which is more prominent for you. Now, as I'm going through this and recording the response, please keep in mind, I'm not a medical doctor. I'm not a psychiatrist. I don't play well on TV. I have a PhD, not an MD, so I cannot even prescribe medication. But I do have a good deal of expertise in psychopharmacology, and I can provide some good information here, but definitely, of course, talk to your doctor about this stuff. So to clarify a few things up front, it sounds like we're talking about somebody that has been diagnosed with ADHD, and they were initially prescribed medication by their general practitioner. I often encounter confusion about diagnosis for ADHD and what that actually involves. In the United States, ADHD diagnosis does not necessarily require cognitive or other clinical testing. It may be different in other places, but essentially the diagnosis itself is based on a list of symptoms, if you meet the criteria or not, and looking at somebody's history. Now, there are certain evaluations like the, neuropsychological evaluations that I do that can be helpful in diagnosing somebody. And these would be to look at things like somebody's sustained attention, meaning how can they maintain attention over a long period of time while doing something kind of boring. Higher level executive functioning. So things like multitasking, things like organizing yourself, planning ahead, stuff like that. And then, also questionnaires. So giving questionnaires related to history of symptoms to not only the person, but other sources of information. So like if they're an adult, maybe to a roommate or a parent or a boss. If they're a kid, often to a teacher or something like that. So you can kind of look at it from different perspectives. But none of these diagnostic tools are technically necessary or required for a diagnosis. And sometimes they can actually be a bit misleading if you don't know how to interpret them because, you can definitely have a person who in practice cannot focus for the life of them, in meetings at work. Maybe they're getting in trouble with their boss because of it. But when they're in the office and they're doing that kind of sustained attention task, they might blow it out of the water and get it, 100% right because they're just trying really hard and they're rising to the occasion. So that's why looking at it from multiple perspectives in an evaluation is important. But yeah, it can be misleading at times. So in many cases, getting a psychiatrist, meaning a specialist in psychological disorders and the medical side of that, can be, very helpful for caring for somebody with ADHD. But your primary care doctor is definitely well within their scope of practice, meaning there's nothing wrong with them also prescribing medication for it, right? So what you're describing here is not an odd situation. I would say this is something that we do see from time to time where it's just the primary care doctor making that call and prescribing the medication. I want to talk a bit about medications here, and I'm going to dive pretty deep. I want to, take the chance to actually describe fully, what the substance is that we're talking about with Adderall. So if you are one of the people that listen to this podcast to fall asleep, as I know there are some of you out there, this is going to be good for you. And if not, stick with me because I'm going to break it down in detail, but I think you're going to be able to understand all of it. So Adderall is a brand name. So we call it Adderall, but it's the medication is a mixture of amphetamine salts. So let's break down what that means. Amphetamine is a synthetic drug, and it's a synthetic drug meaning it is not a naturally occurring molecule. It's something that we made in a lab, but it shares a similar structure to naturally occurring neurotransmitters like dopamine or norepinephrine. And what amphetamine does is it serves as a stimulant. You call it a central nervous system stimulant, meaning it increases arousal, it increases attention, and it reduces fatigue, meaning you're less tired. So it's a drug made in a lab that helps to perk you up. Now, I said that Adderall is a mixture of amphetamine salts. So what the hell does that mean? Well, let's talk about what salts mean. Salts are formed by putting oppositely charged ions together. Often, like when a base and an acid are combined, the reaction produces salts. So in the case of Adderall, amphetamine is combined with various acidic compounds to make a few different types of salts. So why do we do this? Salts and using salts are a common practice in pharmacology, meaning, making of medication, because it helps to change the way that the substance interacts with the body. Like in the case of Adderall, what they do is they use the salts to change how quickly it takes effect, how long it lasts, and how effectively the body metabolizes it, how quickly it uses it up. So, while some people may poke fun at Adderall for basically being, prescription speed or something like that, it's just a stimulant. Actually, it's a pretty complicated substance. And technically speaking, it contains 4 different salts from 2 different isomers, meaning 2 different shapes, structures of amphetamine. So quite a bit of care has gone into creating this substance. Now, Adderall helps with ADHD due to the way that it increases levels of dopamine and norepinephrine in the brain. If those aren't familiar to you, check out a recent episode 380. Just go to deafthepsych.com/episode 380. I did a whole episode about dopamine essentially, but I talk about all the different neurotransmitters, and so that's more of a deep dive on that. But because it increases dopamine and norepinephrine, this is how it gets that effect that we're looking for. Somebody with ADHD, they might have decreased or dysregulated dopamine activity in certain areas of the brain, like the prefrontal cortex. And the impact of this medication can lead to better focus. Now, on the norepinephrine side, what that does is it increases heart rate, blood pressure, and blood sugar, which leads to more alertness, right? So you're more alive, you're more alert. And then you combine that with the dopamine, so they have more control, more focus, and together that can make a big impact. Now, even though it's a stimulant, people with ADHD aren't typically overstimulated by Adderall. Instead, what it does is it helps to balance that neurotransmitter level, and then that leads to increased symptom control. Now, we're going to go ahead and get back to the question at hand, but before that, I want to take a quick break and talk about our first sponsor today. This episode is sponsored by Babbel. I am super excited that Babbel reached out to be a sponsor of the show because, as many of you know, one of my goals personally is to become fluent in Spanish this year, and Babbel has been an awesome addition to my training. Babbel is a science-backed language learning app that actually works. It has quick 10-minute lessons designed by over 150 language experts to help you start practicing a new language in as little as 3 weeks. The tips and tools are approachable and they're rooted in real-life situations. One thing that I really like about Babbel is that it assesses your level of familiarity with the target language before you dive into lessons. That means for myself, I didn't start at the beginner level, but I also didn't start at a level that's totally unapproachable for me. Entonces, si quieres aprender otro idioma este año, prueba Babbel. That means if you're trying to learn another language this year, give Babbel a shot. As a limited time deal for you all, you can get 55% off your Babbel subscription at babbel.com/duff. That's 55% off babbel.com, which is BABBEL.com/duff. 55% off. Rules and restrictions may apply. Okay, so the question at hand here is about tapering off the medication. So for this situation, the first question that I would ask is why? Why is the person wanting to taper off the medication? When it comes to Adderall, as it is with all medication, there are certainly side effects to be aware of. Long-term use of Adderall can lead to a degree of tolerance where you need higher doses to get the same effect. And then with that, you might have cardiovascular side effects that need to be balanced with the person's overall health and any, risk factors they have. For some people, sleep disturbance is a side effect, as is appetite suppression, so weakened appetite, which can lead to weight loss. These are all things, that could happen. But if those side effects are minimal or are balanced out by the therapeutic effect of the medication, why do they want to be stopping? I'm not saying that they shouldn't in this case. I'm just asking what is the reasoning there? Is it a moral sense, right? Is it the feeling that maybe you just shouldn't be on medication if you can help it? Is it because they feel like they should be able to manage with behavioral changes and sort of toughing it out on their own rather than relying on substances? Or is there some physical health concern that we're trying to mitigate here? Adderall does have abuse potential, but this is mainly when it's used in a way other than what's prescribed, meaning you're using it more often or more of the substance than you were prescribed. In your question, it sounds like what you're describing is maybe a little bit more of a psychological dependence, not a chemical dependence, meaning that this person may have the feeling that they can't function or complete daily tasks without it. And this is also more common when medication is being used inappropriately, but it can happen in any circumstance. In a situation like this, I think it's important to consider what the impact of a medication is, though. Because if somebody's been struggling for quite some time with functioning in a given domain, and then they realize that they're able to function quite well with the help of this medication, would you consider that dependence on the medication or just simply finding the right medication for the job? I think you should consider that. Now, if this person in your life feels that it's necessary for them to taper off, they should definitely work out a plan with their provider and take a gradual approach, right? It's not dangerous to go off Adderall, but it is dangerous to suddenly discontinue it. Given the fact that they've been using it to help them manage their life, it will be helpful to taper during a time when they're not under a lot of pressure to perform. For example, if this was a college student, I would say, let's not taper off during finals week or the first week of a new semester. They need to perform during that time. But with this person, as long as they take a gradual approach, they should have relatively little difficulty from a chemical, physical perspective in tapering. Obviously, they're going to be relying more on their coping skills, planning, organization, so support may be necessary there. Now, I don't know what this person's situation is, but it sounds like they do have a lot of support going through the process from various providers. You said psychiatry, you said talk therapist, all of that, which is great. They might encounter things like fatigue. They might have mood swings or irritability, increased appetite instead of the suppressed appetite, sleep disturbances, headaches, decreased concentration, obviously, and then a craving for the medication or other stimulants to try to fill that need. So these are all things that could happen, and recognizing that these are potential symptoms and working with somebody to predict them and plan for them, it can help them not be as startled when the, symptoms occur. And also they can recognize these are temporary and their body will adjust over time, but they just got to get through this period. Right. So, of course, there is a possibility of tapering off this. It's not always a really scary, dangerous thing. It just needs to be handled with care. So we've talked a ton about Adderall. Moving on from that, you also asked about Provigil. Now, Provigil is another brand name for a medication called Modafinil. You may have heard of that before, Modafinil. It's a medication that's used to treat sleep disorders like narcolepsy, where you kind of unexpectedly fall asleep. Sleep work shift disorder, where you work a certain shift, like a night shift, graveyard shift, etc., and you have trouble managing your sleep because of that, and also the impact of sleep apnea. But it is sometimes used as an off-label treatment, meaning this isn't what it was FDA approved for, but it has this other use that maybe is supported in research. It's used sometimes off-label for treatment for ADHD. And then, of course, it is also used as a smart drug. A lot of people in, say, Silicon Valley in the United States and California, they will use, Modafinil as a smart drug to help them push through long periods of concentrated work. Another term they use is like nootropic, N-O-O, nootropic. But yeah, so Modafinil is similar but different. So it's a non-amphetamine stimulant. So it's not the same thing as Adderall. It's not an amphetamine. And it's essentially used to promote wakefulness, so the opposite of sleepiness. It's important to note, though, that the literature, the clinical literature, the research is mixed on how impactful it might be as a medication for ADHD. There's some research on the efficacy in children, but recent studies aren't showing a lot of benefit for adults with ADHD. So there's some question as to whether it's even really effective there. But what Modafinil is, it's a weak inhibitor of dopamine reuptake, right? So the primary therapeutic property here is how it affects dopamine. Inhibitor of reuptake means it doesn't eat up dopamine. It lets it linger there and be used more often. So the side effect of that is that it increases the amount of dopamine in your brain. But the full mechanism of action, we don't really know. We don't really know exactly how it works. We know that dopamine is one part of it. And in some ways, it's kind of similar to something like Wellbutrin, right? Wellbutrin is a medication that is a stronger reuptake inhibitor of dopamine, which we talked about again in episode 380. So yeah, because it's weaker, Modafinil is considered to have a lower potential for abuse and dependence. And compared to Adderall, the withdrawal symptoms are also milder. However, with all of this, please keep in mind, you should typically have relatively few problems with either of them if you're working with a professional and taking the medication as directed. But yeah, so Modafinil, so-so, right? We don't know if it's really that effective for ADHD in adults. There are other medications that could potentially be substituted in here as well if you're worried about the abuse potential or the dependence on Adderall, things that are more research supported. So Strattera is another one. That's the brand name for atomoxetine. I always forget how to say it. Atomoxetine or Strattera. This is a SNRI, so a serotonin norepinephrine reuptake inhibitor. And that helps to control attention and impulsivity. It's not a stimulant like an amphetamine is, but it's more like an antidepressant. So some people who don't want to be taking stimulants do find that there is, an impact for them taking Strattera. There's also Intunive or Clonidine. Intunive is also called guanfacine. And sorry for my butchering of pronunciations. I always have a hard time with the chemical names. But yeah, Intunive, Clonidine, these are technically blood pressure medications, but they appear to be helpful in managing the impulsivity and hyperactivity that can come along with ADHD. So yeah, I mentioned Wellbutrin as well, that, Modafinil is kind of similar to that. By that same token, some people do find that Wellbutrin/bupropion, which is the chemical name for it, is a drug that helps them with their ADHD symptoms. So a lot of different options here. And aside from medication, therapy and coaching can be really effective in helping to manage ADHD. By developing coping skills and organizational strategies and practical ways to manage that impulsivity or the inattention, people can really reduce the impact of ADHD on their lives. Not to mention, ADHD is very often comorbid, so it goes along with anxiety and depression, which we know benefit from therapy. So you can really have kind of a wraparound impact from engaging with a good therapist. But all in all, the person in your life here, they have options. The first one to consider is whether they actually need to taper off Adderall in the first place. The next would be to look at all the alternatives and see if a different drug would be appropriate for the situation. And then if they do decide to taper off, you want to make a plan with their care team and approach the situation carefully to avoid those harsh withdrawal symptoms. If they find that they manage well without the medication, great. If not, they could always go back on it, right? It's not a personal failure to need medication. I don't think we need to judge people for needing medication for this. We wouldn't if it was a thyroid issue or a heart issue, right? So I don't see why this should be any different. But, best of luck to the person that you're talking about in your life. Hopefully this gives you a comprehensive look at what these substances are, things to consider, and also questions to ask about whether this is even necessary to be figuring out. So thank you for that. Hopefully it helps. And before we get into the second question, let's take a break and talk about our other sponsor. This episode is brought to you by BetterHelp. We are still early in the year, which means maybe you're looking for ways to improve yourself, new year, new you, all of that. But what about focusing on the things that you're already doing well and expanding upon them? Personally, last year I realized I was doing a really good job of finding new ways to expand upon the content in this actual podcast. So this year I'm building upon that by finding more ways to repurpose what I have and reconfigure things so that I can free up some time to do what I love instead of just working all the time. Maybe for you, it's about chaining small habits together, like getting exercise, eating full meals, walking outside, etc. Celebrate the progress you've already made and build upon it. A great way to recognize your strengths is with the help of a licensed therapist. So if you're thinking of starting therapy, give BetterHelp a try. It's entirely online. It's designed to be convenient, flexible, and suited to your schedule. You just fill out a brief questionnaire, and that'll get you matched with a licensed therapist to work with. You can switch therapists at any time for no additional charge. So celebrate your progress you've already made. Visit betterhelp.com/duff to get 10% off your first month. That's BetterHelp, betterhelp.com/duff. All right, so let's get into the second question. This one had the email topic line that said, "My therapist talks too much." And what I'm going to read here is basically a combination based on several emails. The person sent the email a few different times, worded differently each time. So I kind of combined them. So this isn't verbatim, but this should cover it. So the question is, my therapist talks too much. I like him and his insights into my life, but I wish he could be paying more attention to me and asking me my questions. But he interrupts me and tells me stories about his cats and dogs or how he crocheted his sweater. He talks about how my situation fits into a movie he's seen and then proceeds to tell me all about the whole movie. I'm seeing him for issues related to my marriage. My husband has dementia and other issues and is controlling of me. I feel like the time we spend together is short. I want to leave there feeling like he was listening to me. I want him to challenge me and help me make plans for the future. I went to him because I have a controlling husband who never listens to me, and he's sort of doing the same thing. What do I do? So this is a really good question. Thank you. And you definitely aren't the only person that I've heard of who's dealing with a situation like this. Now, as therapists, we all have our approaches. Some of this is dictated by the framework or what we call the theoretical orientation we have, meaning you might align more with a specific therapeutic approach like cognitive behavioral therapy or internal family systems, psychodynamic therapy, things like that. And this is basically the set of beliefs that lies behind why people change, where mental health issues come from, and it informs the techniques that you use in therapy. So somebody with a CBT focus is going to be much more likely to zoom in on examining your thoughts and picking out areas where maybe you're jumping to conclusions or engaging in all or nothing thinking. Whereas somebody with more of a psychodynamic approach would be much more interested in hearing about your early life, your relationships with your caregivers, and things of that sort. So that's the theoretical approach, the theoretical orientation. Another aspect that differentiates one therapist from another is experience. Right? There's an interesting phenomenon that has been demonstrated in research where when you look at what you would consider master therapists, their approaches tend to converge as you get more and more and more experienced and you get more expertise. So therapists that have been doing this very successfully for a number of years, they tend to look the same in how they approach situations, even if they started from different theoretical backgrounds. So that's just another interesting thing, right? The amount of experience you have does lead to, in some cases, better outcomes, or at least a more consistent approach. Perhaps the most relevant to this question here, though, is the last factor that I'll mention in terms of differentiating one therapist from another, and that is personality, right? Therapists are people. We are people, and people have different personalities. In my day job as a neuropsychologist, I work in a group practice with several other doctors. And, the owner of the practice, Dr. Landy, he and I have very different personalities. So if we're doing an assessment, if we were seeing the same person, we're probably going to end up with about the same result in overall assessment when it comes to the end, when we've done all the testing and we're making conclusions. But the experience of working with him versus working with me is going to be very different because just the way that we interact, the way that we approach situations, and just what we feel like interpersonally. So I don't blame you for having a negative reaction to the therapist that you have, or, at least some of his tendencies. It sounds like part of the issue may just be his personality and his approach interpersonally. One thing to think about, for example, is if you could imagine that you were not in therapy, but you were having just a meal or coffee together with this person, do you think that you would enjoy being in conversation with them? Or would you probably feel a similar type of suffocation where you're not really being heard? In my opinion, it's not really appropriate for a therapist to use therapy as a platform to primarily talk about themselves. And you shouldn't be getting the feeling that they're just waiting for their chance to talk and not hearing you out. I mentioned this on the show before, but self-disclosure on the therapist part is actually a clinical tool that can be used in session. However, it's typically something that should be used sparingly and intentionally, right? Sparingly meaning you're not spending the majority of sessions talking about yourself, and intentionally meaning there's a clear therapeutic reason for it. I absolutely disclose, things about myself and my life with my therapy patients. Sometimes also in testing settings as well. I did that earlier this week. I was talking with somebody about their suicidality because they've had a really, really hard time. They've had history of it. And we were describing different approaches. And I was talking about ketamine infusions. They were asking more about it and what it actually looks like in practice. And they wanted some more specifics. And so I asked them, would it be okay if I self-disclose a little bit? They said, definitely. And so I shared a bit about, my wife's experience, which we've talked about on the show before, with ketamine infusions and the way that she said they've impacted her life. And she's actually also done the home treatment. So I was able to talk about the differences between them, which was super useful. And the patient thanked me for being honest and sharing that perspective. So that was intentional, right? There was a clear therapeutic reason for me to talk about that. And I also asked permission instead of launching into it. And in my experience, simply asking permission goes a whole long way. Like in therapy, I will often say, what, I have a situation that I've seen like this in my personal life. Would it be helpful if I talked about that a bit? Right? Just sort of inviting the person to say yes or no, like if they actually want to hear about that. And if yes, then you have that buy-in and it's all good. But you don't want to assume that people want to hear about you and just kind of jump into it. So maybe your therapist, I don't know, maybe they have ADHD, maybe they have other things that are making them have trouble inhibiting that impulse to just talk about themselves. Or maybe he's inexperienced and, just is getting started and treats the conversation more like one you might have with a friend. Or maybe this is just his personality and style and he's not a good fit for you, right? There's a lot of possibilities here. But either way, you are totally allowed to want something different. Your attitudes and your expectations for therapy play a huge role in whether you're actually going to be able to make change. So it is important that you find somebody to work with that fits well and that you're confident in. So all of that said, what do you actually do about this? Well, it depends, right? Do you think that there's a possibility that you guys could do good work together and this is just a simple adjustment that needs to happen? Or does it feel more like a fundamental personality or approach issue that probably won't go away? Because you should feel heard. You should feel like therapy is productive. Otherwise, you're really just wasting your time. And if you feel like maybe he's just a little unaware of how much he talks about himself, you could certainly point it out and see if there's a way to change that. In your specific situation with what you talked about, that you're getting help for related to your husband, it could also be great practice in asserting yourself and trying to make sure that your needs are met. So let's say that his name is Mark. I don't know what his name is, but in this situation, you could say something like, Mark, can I talk about our sessions recently? I really like you. I think that you are super insightful, but sometimes I feel like we end up talking a lot about you, and I feel a little left out, like I don't get to talk about me very much. Have you noticed that? Opening that up. Alternatively, if you guys have a lot of humor going on in your sessions, maybe you could kind of just give him shit about it, right? You could say, okay, all right, Mark, look, we're here for me, all right? I don't need to get the whole movie spiel again. What can I do in this situation, right? So you can maybe be a little bit more humorous with it. Whatever makes sense in the context of your guys' work together, that's what you're going to want to do. But alternatively, you can simply find somebody else to work with and see how that goes. It's totally normal for there to be a bit of trial and error when it comes to finding a good therapeutic match. There's nothing wrong with that, and it's very common. If you do decide to stick around and try to continue working with this therapist, I would encourage you to be open with your feelings and explore them in therapy, because you might be experiencing a little bit of what we call transference, meaning your relationship with your therapist is echoing the relationship with your husband. And in the right hands, that's something very powerful, super powerful that you can work with in session in the moment. And it's possible to get to a point where you're in session and you feel that you're being controlled and you want to assert yourself in session as a way to practice and feel out asserting yourself to your husband. Again, not every therapist is going to be the best at working with this type of immediacy and interpretation of things like transference during a session, but it could be worth a shot to find out if you can do that. But I want to encourage you, you're not doing anything wrong here by having these feelings. You're allowed to trust your gut and your intuition that this doesn't feel very satisfying or helpful to you. If you do decide to move forward, I wish you the best of luck. And I also want to encourage you to look for, aside from just the therapy for yourself, family and caregiver resources in your area. It sounds like your husband's dementia is playing a role in his behavior and it's impacting you. So look around. If you just search for caregiver resources with your zip code or with your county name, there could be support groups, classes, or other helpful tools that you can access. Don't forget that you need help and support in that realm as well. So thank you for the question. I wish you the best of luck. I hope this works out for you. And yeah, that's it for this episode, guys. Thank you. Thank you so much for joining me in this episode. If you would like to send a question or a topic for a future episode, please email me at duffthepsych@gmail.com. If you like my approach and would like to learn more about my books, online course, or other resources, please head over to my website at duffthepsych.com. And lastly, it would mean so much to me if you would leave a review for the podcast wherever you listen to it, or share an episode with a friend. Until next time, you got this.